Hello, and welcome to the clinic. My name is Norman Lowry. I'm the Executive Director, and this is an orientation video to help you understand what we do, how it works, what's going to happen in this visit, and how your body could heal itself without the use of drugs and surgery. The first thing that I want to go over with you is the idea that the body is alive and intelligent. Mostly we don't think about this because the body is so automatic. But if you had to control your immune system, blood pressure, heart rate, you probably wouldn't have time for anything else. It's like there's this onboard intelligence that's like running your body for you on automatic mode so that you don't have to fool with it. Your nervous system is electrical, and the amount of data flow through it to control these body functions is equivalent to all the telephone networks of the world combined. It's pretty impressive. Your body's actually pretty impressive. As a matter of fact, it can compensate and adapt for some really amazing things. You can surgically remove all sorts of body parts, but yet it just continues to work. Imagine what would happen if you did that to your car. It'd stop right away. So therefore, the body's not a machine. It's alive, it's intelligent, and not only can it compensate, but it can also repair and heal itself, sometimes of some really amazing things. The next thing I want to cover with you is the difference between what we do and what medical doctors do. Medical doctors intervene using drugs and surgical techniques to work on your body, which is great because they can save your life. It's a little bit like your house catching fire. You need to call the fire department to put that out because it's more than you can handle on your own. But the next morning, you come back and your house is not looking too good, having burned the night before. And I'll bet you're not going to call the fire department to come back with their hoses and axes to rebuild your house, because you're going to call a building company to do that work for you. Well, we're the building company. One thing that's very interesting about the way that the body heals is that it can only heal itself. For example, if you break your arm and the doctor needs to come in and set that arm to get the bones to line back up, after that cast is on, there's really not a whole lot the doctor can do to help the arm to heal, because only the body can cause that bone to knit. After all, who knows more about your body, do you think? Your body or the best doctor on the planet? This is how we operate. We operate as your body's assistant to help it to heal itself. Let me explain this assistant idea a bit. If you've got chronic health problems, that is, problems that aren't getting better, what it means is that your body got hung up or stuck at some point in its ability to heal itself. It was healing along and it hit something that it couldn't handle and got stuck. This produces two problems. The first would be the health problems and symptoms that you're experiencing right now. The second would be that with your body hung up in its ability to heal, your defenses are less than they should be, which increases your chances of health problems in the future. Our job as an assistant is to help your body by finding the exact point where you got stuck and then finding out what materials, replacement parts, and tools that it needs to get over the top and regain its ability to heal. Once your body's regained its ability to heal, our job is done. We're just here to get the body unstuck. So the question is, how do we communicate with the body to find out where it's stuck and what to do about it? The answer to this is called reflex testing. Reflex testing uses the body's own nervous system as a piece of test equipment to find out what's going on with the body. This allows us to use the body's intelligence to find out what's happening rather than having to guess on our own. Let me show you how this works. Here's a body, and it has an electrical nervous system. So per the laws of physics, there's an electromagnetic field that surrounds that body. Testing has shown that if you place a substance, there's a substance, anywhere inside that field, that the body knows what that substance is. A case in point is severe allergic reactions, where people will go into a very severe reaction to, say, peanuts just by getting the peanut close to them. They don't actually have to smell it or taste it or touch it. When this occurs and the body knows what it is, there are a couple of reactions that can occur. The first would be that their body finds no stress in that substance at all, and so nothing happens. The second would be that the body does find that this substance is stressful. For example, as I mentioned before, the peanut to the person that's allergic to it. And what you get are reflexes or involuntary body responses that kick off as a result of the stressful substance in the body's field. There are a number of these reflexes that can be tested. The easiest one to test is called a muscle strength reflex. The way this works is that you would test the strength of any muscle, let's say the strength of this arm right here, testing this muscle right here, with a benign or harmless substance in the body's field. Nothing happens. It stays full strength. However, if you put a stressful substance into the body's field, this muscle simply collapses and the arm would get very weak. The reason this occurs is because of a fuse called a Golgi tendon organ, or a GTO, which exists in every single muscle of your body. The purpose of the fuses are to prevent the muscles from hurting themselves if you were to overstress them and keep them from tearing. Apparently what happens is when you put a stressful substance into the field, it halfway kicks off every single fuse in the body on all the muscles. So therefore, of course, if you put stress on the muscle, it collapses very easily. The fact that we can test the difference between a stressful and non-stressful substance means that we have the ability to use the body's intelligence to find out whether a particular and very exact substance is stressful or non-stressful. By using a series of many items tested, we can get a tremendous amount of information about the body and be able to find out where it's stuck and what to do about it. To make reflex testing clear, I'll demonstrate it on a patient. Hi.
Hi.
I've got two glass test files here. This one contains harmless substance. This one contains a nasty toxic chemical which should kick a reflex off on you. Okay?
Okay.
Good. We use glass test files because glass is an excellent conductor of electromagnetic energy, so I can just test these on you without having to open them up or pour them out or anything.
All right.
Good. So the easiest muscle to test is the deltoid. That's this muscle right here. And to test it, what I'm going to have you do is just put your arm out right here. And if I put pressure on your wrist, then what you do is use this muscle to resist my pressure. So I push down, you push up, and your arm doesn't move.
Okay.
So I'm going to push kind of hard because we want to see how strong it is. You ready? Here we go. Good. That feels really strong. Okay?
Okay.
So the first thing we want to do is to put into your body's electric field the harmless substance right here. So I'm just going to put it right in your hand. That goes in your field. Then we're going to retest. Okay? So I push down, you push up. Feels really strong. I can't tell any difference at all. Does that feel the same to you?
Yeah.
Good. Next thing we're going to do is to put the toxic chemical into your body's electric field. And that kind of freaks your body out a little bit. So I push down, you push up, and except this time, it goes right down.
Wow.
That's kind of interesting, isn't it? And let me
Yeah.
show the people on video here what we're dealing with. So I can just use one finger here, and it just goes right down.
Wow.
Can't hold that up, huh?
Yeah, that's
Good.
weird.
Cool. Okay, good. Thank you very much. Your next step in today's visit will be a computerized test of your nervous system to determine your body's overall level of health. This will show us your body's level of function as well as its ability to adapt to stress. The test is called a heart rate variability test and was developed from over 20 years of intensive research funded by the U.S. Navy. This test lets you know your level of health now as well as giving a comparison point so you can see your progress from your program. The doctors will use detailed information gathered from this test to help work out your exact program. As part of your visit today, you'll see a doctor for a full evaluation. The doctor will review your history and complaints and conduct additional testing. This testing is called autonomic response testing, or ART, and uses the type of reflex testing demonstrated earlier in this video. This testing will find the reason why your body is having trouble right now and identify the reasons why there is trouble. From this information, the doctor will design a natural health improvement program specifically for you. This program will handle the exact reasons why your body is having difficulty in healing. Okay, so just one more thing you need to know. When reflex testing was first being researched, it was found that when you have a person with a health problem, they have less electricity in their nervous systems than is normal. This makes them very hard to test accurately. The solution to this problem lies in the field of conductivity. If I was being electrocuted and I touched you, what would happen to you? That's right, you'd get shocked too. The electricity conducts from me to you simply by contact between the two of us. So here's the way this works as far as handling reflex testing. A healthy person has a large electromagnetic field around them, because they have a very strong nervous system. A person with a health problem has a much smaller field. So what you want to do is to use the healthy person's stronger field as an amplifier to get a much better, more accurate test off the unhealthy person. This is done simply by having the healthy person contact the unhealthy person simply by touching. This allows the electricity to flow between the two of them. So when we are testing you, we'll be testing an assistant who's a very healthy person rather than testing you directly. I hope you enjoyed the information in this orientation. I wish you the best of luck in handling your health problems, and may you never be the same.